Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we are very busy. We're getting ready for our Labor and Delivery Symposium of 2025, something that is, of course, so near and dear to my heart. And today I have a special guest with me here, Alisha Parker. Hi, Alisha.
Hi.
It is so fantastic. You are talking about, of course, as a wonderful labor tool in our symposium, and your presentation is titled Not One Size Fits All, Mastering Peanut Ball Use in Labor. I can't wait to find out more about that because it's such a fantastic tool in labor. But before we jump into that, tell us a little bit about yourself. Where in the world are you? And tell me a little bit about your professional background.
Hi. So I live in Little Rock, Arkansas, and I am a labor and delivery nurse. I've been a nurse for 12 years and in labor and delivery for 11. I had my oldest who is 11 and used the peanut ball, and I said, "Oh my goodness, I'm gonna go be a labor and delivery nurse." So I've been there since and had two more kids and use the peanut ball daily and just love it so much.
That is absolutely amazing. From your own experience, right, with a peanut ball, you decided, okay, I want to change to labor and delivery, and not only that, I will become, expert in peanut balls as well. I find that absolutely fascinating. For those of you, for us here who are maybe less familiar, tell me a little bit about the peanut ball and how is it different from any of the traditional birth balls?
So a birthing ball is more circular, like a sphere, and you sit on it um, throughout labor. A peanut ball is the same material as what a birthing ball would be, exercise material kind of ball shaped like a peanut. It was first used in the 80s during physical therapy and different things that they were using that for. And then later was found to be helpful with women while they were in labor in different positions to help open the pelvis, to help the baby come down some more, and to help make progress. So that's why we love it because it can help with those things throughout labor. And it's a very effective tool.
It is indeed. And your title of your presentation is titled Not One Size Fits All, Mastering Peanut Ball Use in Labor. So that indicates we're using more than one ball. Is that correct?
That is correct. There are multiple sizes that we use for different things. There's one that you can sit on, the other ones you don't sit on. So lots of different sizes for different positions that you can put your patients or your clients in.
And what is fascinating is, right, like depending on how you use it, it depends on how where labor is in that particular moment, right? Like, I assume there is a lot more to it than just saying like, oh, here's your peanut ball. You will show us directly like positions and what how beneficial it is and what does it do for during labor that use, right?
Yes. So we'll talk about different positions that you use for different levels of the pelvis to help get the baby to rotate in a more optimal position to come through the pelvis and deliver. We'll talk about different stations of the pelvis, which is the levels of the pelvis, and what to do when and what to do in regards to like positioning of knees and how that's really important. We'll go over all of those things.
Fantastic. Now let me ask you this: Can a peanut ball used also with an epidural, or is this just the person has to be absolutely mobile and moving around with this?
Actually, at the hospital, we use the peanut ball a lot, for patients with and without epidurals. It's very helpful, if a patient has an epidural and they're unable to get up out of the bed, using the peanut ball still allows for opening the pelvis and making more room. If you had someone that didn't have an epidural, they're able to get up more freely and move around, do some more positions to help open the pelvis. You're limited if they have an epidural and able to get up out of bed. That's not recommended. So, using the peanut ball as a tool is non invasive and it's really helpful in making progress. So, we find it very beneficial for patients with epidurals.
Now, from your very own experience, I'm not asking for any study results or anything like that. Have you seen that the use of the peanut ball, may reduce the need of pain medications?
I have seen that for patients that have decided that they don't want to get an epidural for whatever reason, personal preference, medical preference, anything like that, I have found that it has been beneficial in regards to managing their pain, only for the matter of we're able to get the baby in a more optimal position, and that helps with their comfort in helping make progress through labor. So it can be very beneficial in that regard, and also allows them with different positions if we place them in the bed to allow them to rest if they're not able to get an epidural or they just decide they don't want to or don't want any pain medication. It's very useful with or without the epidural.
Beautiful. That's good to know. It's a great tool, no matter what the choices are of the birthing person there,
Yeah.
and for their birth, whatever is right for them. That's fantastic. Now, I can imagine, as any tool that we use, right, there could be also downsides to it, or maybe mistakes in the use. What common mistakes do you usually see when clients are using the peanut ball, or maybe staff that might not be fully trained in it, and they just see, oh, there's a peanut ball in the closet. Let's get that thing out and use it. Is there anything that we could need to be aware of, or any mistakes that could be avoided?
Yes. So sometimes if you're using a peanut ball, you can select the size that might not promote the most benefit for the laboring person. So you can pick one that's too small or too big, and that can cause discomfort. You want to make sure that you're sizing it appropriately, which is something that we'll talk about.
Absolutely. That's wonderful. Yeah. So there are some things to look out for. Now, tell me a little bit about training. You will talk for us for an hour, but you're also a trainer, right? Talk to me a little bit about that aspect. So, if providers or nurses or anybody who works in that field wants to know more and gets further training, what can you recommend?
Right. So I work with Premier Birth Tools, and at the hospital that I work at, there are 5 trainers. We went through the training course to become official trainers. I've been working with peanut balls since I had my oldest, but also have been teaching a course at our hospital for new labor and delivery nurses. But in regards to getting more like official training, we decided that we would go through the Premier Birth Tools training course. It's very involved, a lot of research and developing a video, a training course, which is what we are using now to train the nurses at our hospital. All of the nurses required in our hospital and all of those connected with our hospital are going to be required to take our peanut ball training course. And then we're going to offer it to the state and from there. So it's a lot of training and hard work, but it's so worth it. And we found on our unit how beneficial it has been in decreasing our C-section rate.
Oh, fantastic. Oh, that's such a wonderful thing to hear. Reducing
Yeah.
C-section rate, right? Like we all want that to see happening. So what a wonderful tool then, the peanut ball. So, Alicia, before I let you go, any last words for our viewers? What are you hoping that they will take away from this presentation?
I'm hoping that you just learn about peanut balls and learn the significance of them, how it can be helpful in learning some great tools in regards to what can we do when and how will it be helpful if I'm helping a laboring woman or person in making progress and thinking through those things on what's the correct position, what do I need to take into consideration, and taking those things back with you as you're learning and able to implement them in your practice.
Oh, love that. Implemented in the practice, something they can actually share then and take to their practice. Wonderful. Thank you, Alicia, so much for being here with me today. And we're looking forward to your presentation here at Gold.
Thank you so much. So glad to be a part of it.
And some information now for our viewers, if you would like to find out about this fantastic presentation with Alicia Parker and all the other presentations in the symposium, we invite you to go to goldlearning.com. On October 6th, we have a free open access live keynote presentation for you that you can also sign up and reserve your seat there as well. Don't forget to share that also with your colleagues and friends in the field. We want to make sure that everyone takes advantage of this free education as well. Thank you, everyone, for watching. watching, and we hope to see you at the symposium. Bye-bye, everyone.